Heart disease refers to a range of conditions that affect the structure or function of the heart. These conditions can vary in their types and risks. It's important to note that heart disease can affect individuals of all ages, although certain types may be more common in specific age groups. Acquired heart disease refers to conditions that develop over time, while congenital heart disease is present at birth. Let's delve into the different types of heart disease, their risks, causes, and prevention methods. Types of heart disease. 1. Coronary artery disease, CAD. This is the most common type of heart disease and occurs when the coronary arteries that supply blood to the heart become narrowed or blocked by a buildup of cholesterol and other substances, called plaques. 2. Heart failure. Heart failure refers to a condition where the heart becomes unable to pump enough blood to meet the body's needs. It can occur due to various underlying causes, such as CAD, high blood pressure, or damage to the heart muscle. 3. Arrhythmias. Arrhythmias are abnormal heart rhythms that can cause the heart to beat too fast, tachycardia, too slow, bradycardia, or irregularly. They can occur due to factors like heart damage, certain medications, electrolyte imbalances, or congenital abnormalities. 4. Valvular heart disease. This condition affects the heart valves, which control blood flow within the heart. It can involve valve narrowing, stenosis, or valve leakage, regurgitation. Causes may include congenital defects, infections, or age-related degeneration. 5. Congenital heart disease. Congenital heart disease refers to structural abnormalities present at birth. These defects can affect the walls, valves, or blood vessels of the heart. The age at which symptoms appear depends on the specific defect and its severity. Risks and age of onset. The risk factors and age of onset can vary depending on the type of heart disease. 1. Coronary artery disease. Major risk factors include smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity, and a family history of heart disease. It typically affects individuals age 40 and above, but risk factors can contribute to early onset in some cases. 2. Heart failure. Risk factors include CAD, high blood pressure, previous heart attacks, diabetes, obesity, and certain medications. It can affect individuals of any age, but the risk increases with age. 3. Arrhythmias. Risk factors include age, heart damage, high blood pressure, heart attacks, heart valve disorders, certain medications, and illicit drug use. The age of onset varies, with some arrhythmias occurring from birth, congenital, and others developing later in life. 4. Valvular heart disease. Risk factors include age, previous infections, congenital defects, and certain conditions such as rheumatic fever. Age of onset can vary depending on the specific valve defect. 5. Congenital heart disease. The age at which symptoms appear depends on the specific defect and its severity. Some defects may become apparent shortly after birth, while others may present later in childhood or adulthood. Causes of heart disease. The causes of heart disease can be multifactorial and depend on the specific type. 1. Coronary artery disease. The main cause is atherosclerosis, which is a buildup of plaques in the arteries. Risk factors such as smoking, high blood pressure, high cholesterol, diabetes, and obesity contribute to the development of atherosclerosis. 2. Heart failure. Heart failure can result from conditions that weaken or damage the heart muscle, such as CAD, high blood pressure, heart attacks, heart valve disorders, and certain infections. Other factors include alcohol or drug abuse, certain medications, and inherited genetic conditions. 3. Arrhythmias. The causes of arrhythmias can be diverse and include heart damage from heart attacks, congenital abnormalities, certain medications, electrolyte imbalances, such as low potassium or magnesium levels, drug use, and conditions like hypertension or thyroid disorders. 4. Valvular heart disease. Valvular heart disease can be caused by congenital defects present from birth or acquired conditions such as infections, such as rheumatic fever, age-related degeneration, or previous heart attacks. These factors can lead to valve narrowing or leakage, affecting blood flow through the heart. 5. Congenital heart disease. The causes of congenital heart disease are often unknown, but certain factors can increase the risk. These include genetic abnormalities or mutations, maternal infections, such as rubella, during pregnancy, exposure to certain medications or drugs, or a family history of congenital heart defects. Prevention of heart disease. While not all heart diseases can be completely prevented, there are several key measures individuals can take to reduce their risk. 1. Maintain a healthy lifestyle. Adopt a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit the intake of saturated fats, trans fats, cholesterol, sodium, and added sugars. Engage in regular physical activity and maintain a healthy weight. 2. Don't smoke or use tobacco products. Smoking significantly increases the risk of developing heart disease. Quitting smoking and avoiding secondhand smoke can have a positive impact on heart health. 3. Control blood pressure. Keep blood pressure within a healthy range through a combination of a healthy diet, regular exercise, stress management, and, if needed, prescribed medications. 4. Manage cholesterol levels. Maintain healthy cholesterol levels by reducing the intake of saturated and trans fats, increasing dietary fiber, and if necessary, taking prescribed medications. 5. Control diabetes. If you have diabetes, it's essential to manage blood sugar levels through a healthy diet, regular exercise, and medications as prescribed by your healthcare provider. 6. Limit alcohol consumption. Excessive alcohol intake can contribute to heart disease. Limit alcohol consumption to moderate levels or as advised by your healthcare provider. 7. Regular checkups. Schedule regular checkups with your healthcare provider to monitor your blood pressure, cholesterol levels, and overall heart health. Early detection and management of risk factors can help prevent or minimize heart disease. 8. Manage stress. Chronic stress can contribute to the development of heart disease. Find healthy ways to cope with stress, such as practicing relaxation techniques, deep breathing, meditation, yoga, engaging in hobbies, socializing, or seeking support from loved ones. 9. Stay physically active. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous exercise every week. Regular physical activity helps maintain a healthy weight, lowers blood pressure, improves cholesterol levels, and enhances overall cardiovascular health. 10. Know your family history. Understanding your family's history of heart disease can provide valuable insights into your own risk factors. If there is a history of heart disease, inform your healthcare provider, who can assess your risk and recommend appropriate preventive measures. 11. Practice good oral hygiene. Poor oral health, particularly gum disease, has been associated with an increased risk of heart disease. Maintain good oral hygiene by brushing your teeth at least twice a day, flossing regularly, and visiting your dentist for routine checkups. 12. Control other medical conditions. Properly manage and control medical conditions that can contribute to heart disease, such as obesity, high blood pressure, high cholesterol, and diabetes. Follow your healthcare provider's guidance, take prescribed medications as directed, and make necessary lifestyle modifications. 13. Limit processed and sugary foods. Processed foods and those high in added sugars can increase the risk of obesity, diabetes, and heart disease. Opt for whole, unprocessed foods as much as possible and limit sugary snacks, sodas, and beverages. 14. Get enough sleep. Poor sleep or insufficient sleep has been linked to an increased risk of heart disease. Aim for 7 to 9 hours of quality sleep each night to support overall cardiovascular health. 15. Avoid illicit drug use. Illicit drugs, such as cocaine and amphetamines, can significantly damage the heart and increase the risk of heart disease. Avoid their use altogether. It's important to note that these prevention strategies are general recommendations. Your healthcare provider can provide personalized guidance based on your specific health profile, risk factors, and medical history. Additionally, early detection of heart disease is crucial for effective management. Regular checkups, screenings, and discussions with your doctor can help identify any potential issues early on, allowing for prompt intervention and treatment. Remember, the prevention of heart disease is a lifelong commitment to healthy habits and regular medical care. By taking proactive steps and making positive lifestyle choices, you can significantly reduce your risk of developing heart disease and enjoy better heart health. Subscribing and liking the video are a great help. Thanks for watching.